Okay. Okay. All right. So going to share my screen. So welcome everyone to today's webinar. So this is all about helping our final year learning disability students make the most of all the opportunities that they can to maximize their chances of getting roles when they graduate very shortly, I hope. So we're looking forward to being able to support you in that way. And just to give you some background information, some of the things that we'll be talking about today, I'll give you some background information on registration. And then we've also got Claire here, who's going to talk about what she did in order to secure her first role, and some information about the student app from Davinia, and about interview technique from Kate, and also from Jonathan as well from the RCN to talk about his career journey. But I'm going to get everyone to introduce themselves shortly. What I am going to do is I'm going to share my screen so that we can see what the agenda is and everyone can be aware of what we're going to be talking about today. Is that sharing now? Can everyone see that?
I can see a lot.
Okay, good. I'm going to put it into slideshow then, put it into present mode. Okay. So give it a second and it should all be coming live. Yes, Mary can see it. That's excellent. I'm very pleased about that.
It's still a lot, Mandy, though. It looks like it's about 6 different views at once. So 1, 2, 3, 4, isn't it?
Yep, it's just taking a little while to upload. What I can do is, if it really struggles, is I'll stop sharing and I'll just I think I'm going to have to stop sharing. Isn't technology wonderful when it works? Okay. So I think what I'm going to have to do is just share the slides individually, because obviously it doesn't want to load up the slide deck as I've got it at the moment. So, and of course now I've put them all away because I was going to present it all in one. So that's still trying to present. While we're waiting for technology to sort itself out, can I get everyone to introduce themselves? So Claire, if I can start with you.
Hello, I'm Claire. I'm a community learning disability nurse. I'm based at Cambridgeshire Peterborough Foundation Trust in the South Cambridgeshire part of the Learning Disability Partnership. Yeah.
Thank you, Claire. And then if I can move on to Wendy, please.
Hello, my name's Wendy Fowler. I'm Nursing Education Advisor with the NMC.
Thank you. And Jonathan?
Yeah, I'm Jonathan Beebe. I'm a registered nurse in learning disabilities. I am professional lead for the RCN, that's professional lead for learning disabilities and for neuroscience. And I am also CEO and nurse consultant of PBS4, a social care provider.
Thank you. And Kate?
Hi, I'm Kate Morgan. I'm one of the senior clinical managers in the East of England. I'm a nurse by profession, but I have the privilege to lead our regional student council, and it's great to be here to talk to you about interview preparation.
Thank you. And Davinia.
Hi, I'm Davinia Rogers, and I'm Clinical Learning Environment Lead within Central East ICB in East of England, and I lead on the Healthcare Learner Toolkit app, and here to talk to you about it today. Thank you.
Okay, that's brilliant. Thank you so much. I'm still having difficulty sharing, so what I'm going to try to do is I'm going to try and share my screen again and just show you the agenda quickly, and then we'll move on to Claire's presentation. And Claire, unfortunately, if I'm struggling, if my laptop doesn't want to work for me, I might have to get you to share your slides after saying, I'll manage them, don't worry. But we'll just see what happens. Okay, is that sharing now? Okay, we'll try putting it into just ordinary slideshow this time. All right, can everyone see that? So thank you, because I can't see anyone at the moment now. So we've gone through welcome and introductions. So the next speaker is going to be Claire, who's going to talk to us about her journey that's guided her. And then Wendy will talk to us about the NMC and the what happens when you register. And then Davinia will talk about the support from the app. And Kate will talk about interview preparation, and then Jonathan about his career opportunities, and then we'll close. And if anyone does have any questions, as we're going along, please do put your hand up and ask them in the chat and manage them. Okay, so now my camera's not working either, so I'm not doing very well at all today. And am I back? Can you see me now? Can you see me? Thank you.
You're
because
back. Yes,
I think I think I also froze. Isn't it marvelous? It's been working all day up until now, and I really need it to work. Okay, so I'm going to stop sharing. And then what might be best, Claire, is if you're happy to share your screen and do your slides, because I think my laptop is going to give me trouble today.
Yeah, that's fine. Let me just try. Haven't shared on Teams for a while.
Don't worry. If not, don't worry. I can. I'll try again.
Can you guys see that?
Yep, we can see
Yes.
that. That's perfect. Thank you.
I'll put it into slideshow. Oh. Has it gone into slideshow mode?
Not yet.
No, it's not for me either. Oh, there we go.
There we go.
Hello everyone. I already introduced myself as a community learning disability nurse, but I'm coming to talk to you today about my journey into becoming a newly qualified nurse, because I only qualified in September and I secured my job role in September and started my job in October of last year. So I'm very newly qualified, and but I know the importance of the feeling of wanting to get a job as a student. And although I'm a bit nervous, I really wanted to come and talk to you about finding a job as a student. I have actually been really fortunate in my job role that I found my job within my final placement of uni. But I did take some steps to get myself in that position. So I studied at Northampton University, but I live in Cambridgeshire. So my all my placements were in Northampton and Milton Keynes, and I knew that I wanted to get back over sort of either Cambridgeshire way, Hertfordshire, Bedford, somewhere this way. So I sort of kept in mind the liaison nurse from Addenbrooke's Hospital and the learning disability liaison nurse, because I'd come across her within my old job role. And so I kept in touch with her. So basically I sent her an email when I was in year one saying, I've started learning disability nursing. I want to keep you in mind for my final placement, because I knew my final placement I would sort of be able to choose. And she was like, that's great, amazing, keep in touch, kind of thing. And then about, I think, a year before my final placement, I got in touch again and just said, look, can I come on a placement with you, or do you know of anyone? And so she put me in touch with CPFT, with the Learning Disability Partnership. And that's where the process started for me, was getting in touch with Marianne, the lead nurse. And yeah, I just tried to do everything in as far in advance as possible, get in touch with as many people. And then, yeah, my final 15-week placement was with CPFT. And as I got there, a few weeks in, they told me that Band 5 jobs were coming out, which I just couldn't believe, because community nursing was really where I wanted to be, and in Cambridgeshire, which was amazing. And so, yeah, so I applied for the job. I got it in September, and I was very, very, very lucky. So I feel really fortunate that I landed myself a job quite so easily. So, but that's not the experience of other colleagues and friends of mine who I went to uni with. So I wanted to share their experiences as well of trying to look for a job and any tips I can give you. So yeah, but I will move on from my experiences. So places to look for jobs. So this isn't like the only places you can look for jobs. I'm sure there is many more out there, but Track Jobs is where I did my application. And so that's, I think, one of the main places you can look for jobs. NHS Trust websites, if you know the trust that you want to work for. So for me, it would have been Cambridge and Peterborough NHS Foundation Trust. Have a look on their websites, any jobs that come up. NHS Jobs is another really good place to look for. And then, as well as the NHS, you've also got the private sectors where you can get jobs. But I would just make sure you have a look at the benefits of the NHS and the benefits of private working. They're very different. But my penultimate placement was with Elysium Healthcare, which was a private hospital, and I loved it. And I would have considered a job there if I hadn't have you know, got my job in the community. So I was kind of lining up places on my final year. When I was at Elysium, I went and spoke to the lead nurse there and said, oh, you know, is there a possibility of any jobs? So just put yourself out there, like, as much as possible. Is there anything else to say on that? I don't think so. So my friend said to me that a really good way to sort of get job alerts for learning disability nursing is to go on the jobs by email on Track Jobs. So you can set up a profile on Track Jobs, and then I went on it and had a look at it. So this is what I typed in. So I just put in band 5 grading, and then I think there was about 4 different learning disability areas. So I think it was like community, I can't remember what the others were, but there was an inpatient one as well. So there's 3 or 4 that were specific to learning disabilities. And then you get emails when jobs come up. My friend said, be careful because some of the emails might go in your junk mailbox. So just always check your junk mailbox. So you can set that up on Track Jobs. A big piece of advice is to be prepared. So when you're filling out applications, I would say that the biggest thing that well, it depends how old you are, I suppose, but if you're a bit older, if you're a bit more of a mature student like me, it takes a long while to fill out your employment history and your qualifications. So I would just make sure you have those ready. So again, on Track, you can either do a profile on there where you can upload all your stuff ready to go, and then it just goes into your application, or you can do like a Word document separately and have them ready, or if you've got a CV already, just make sure that's up to date, because I feel like this is some of the like annoying part of applying for a job. So they're the best things to kind of get ready, and I've given some examples of what you just need. I appreciate that when I did my GCSEs that I was letters, and I realised that now they're numbers. So complete your application in a timely manner. And by this, I don't mean rush it. I mean that preparation of getting your qualifications and getting your employment history ready is really important. A few of my friends went for a job in Northampton that was just highly, like, everybody wanted to go for it, and it was live for 2 weeks and it closed after 3 days because they had so many applicants. So some jobs can close earlier if they've got enough applicants. So don't rush it, but just know that although it says 2 weeks, try and get it done in a timely manner, because it might be that it closes a bit earlier. Anything on that? It's just important. It's just why it's important to have that preparation ready to go. The other thing with preparation is you'll have your supporting statement that goes along with your job role. And my biggest bit of advice is don't use AI to write your job application, because being a nurse and hearing other people talk about job applications and the amount of applications they get that are written by AI and it's so obvious is really disheartening, because it's your personality that wants to come out in your application, and just use that, because learning disability nurses are amazing and we deserve to have our personality shining through our applications. Learning disability nurses are really important, and there will be a role for you. I know it's really scary, but we're all in these little pockets in places, and we may not be completely out there and in your face, and you might not know about them. Like, I didn't know about the community nurses in Cambridgeshire at all until I was put in touch with them from someone else. Don't be afraid to email professionals. We're not scary. I'm very newly qualified, and I've been trying to help, other people to find jobs, because I know how scary it is, and professionals will always want to help, put you in placements or spoke days or things like that, and want to meet you. If you're at the end of your sort of uni journey and you've already got your placements sorted, try get insight days or spoke days in areas you might want to work, or just near someone, or anything. Just really try. I know you need to have the courage to do it, and it's hard, but try and put yourself out there, because it's the way that you connect with people, and that's part of the reason I got my job, and I feel really lucky. So yeah, I think that's it. I don't know if we're doing questions now or later, so apologies, I'll just put that in.
Look at this, I even forgot to take myself off mute. I do think we have a few minutes, Claire. If anybody does have any questions that they wanted to ask Claire now before we move on to Wendy. But other than that, put them in the chat, or if we have time at the end, we'll take some questions then. No, I think if anybody does think of anything, please don't worry. Just put your question in the chat, or as I say, put your hand up and ask at the end. We're not scary, we don't bite. So feel free to ask a question. Okay, thank you, Claire. That was amazing. That was really good, really good advice for everyone to take on board when thinking about the job. So thank you for sharing your journey. It's been great to hear. Thank you.
Oh, you're welcome.
Okay, so Wendy, if I can get you to come in now, please.
Thank you. Hello, everyone. I have got a presentation just so I can remember to talk about everything I say I was going to talk about. So if it's okay that I share my screen, is that all right?
Yes, please, because my screen is still telling me it's trying to put the previous presentation up.
Okay, so we're on the question before last, as it were. Right, let me just, so I'm working over 3 screens, and as always, that happens, you lose your mouse. There he is. So I will just hit share, and hopefully this happily works. I will shift between the presentation and another document, if that's all right. Can you all see this as a slideshow?
Yes. Well, not yet as a slideshow now. It is now. Thank you.
I'll just, 1 second. I'm just going to minimize another screen so I can. There we are, see you. So, hello. I'm going to be talking a bit about the role of the NMC, how things work in terms of your registration with us. I have also got some information around the code and revalidation reviews, because I do talk about that a lot, and I always feel I'd like to. But if we do have time to talk about that, we can do that. Otherwise, I can actually, Mandy, if it's all right, to share this presentation as a PDF at the end, so folk have got that information at their fingertips if they'd like to look at it. And we can spend a little bit longer talking about other things. That's fine. So anyway, hello. This is me. My name's Wendy Fowler. I'm a nursing education advisor. I am a registered nurse. Full disclosure, I'm an adult nurse. Actually, I'm a general nurse because I am very old. I joined in the last century. I started working with the NHS in the last century. And there's me at my last NHS job before coming to work at the NMC. And that's at the Lister Hospital. I don't know if any of you know that place. So I was pre-registration education lead nurse, and I was there with one of my current students, current student at the time, and she was wearing a vintage nurse's uniform. Not sure how I feel about that, because that was my nurse's uniform when I was a student nurse a very long time ago. So I'm going to talk a bit about the role of the NMC, and I will talk about what to do, the practicalities around getting your PIN. And if we get a moment to talk about the code and revalidation reviews, we will. I might just whistle through those and give you that information later, but we will have time for questions, time for reflections, and no question too big, too small, or too wild. Just go for it. Stick it in the chat or raise your hand. We will pause at the end, and we can talk things through. If I don't know the answer, I'll find someone who does. So, 3 key roles at the NMC: regulate, support and influence. Core role is to regulate. To make sure we do that as well as we can, we need to support the individuals in our register, share our intelligence and work with others, influencing workforce planning and sector-wide decision making. And that is influence rather than actually control, if that makes sense. To remember that we regulate the individuals on the register rather than healthcare organisations. All that we do at the NMC is best illustrated on this one slide. So let's start in that bottom left-hand corner around education and professional standards. These are our standards such as the code, standards for revalidation, and also the education standards, so standards for education programs, which and the standards for student supervision assessment, and the ones that for those of you who are students, the standards of proficiency. And I think this is worthwhile talking a little bit about our standards, which are outcome focused. And I think that's really important. It reflects a little bit about what Claire was talking about when it comes to talking about looking for a role. The expectation is that our proficiencies are met, and they don't have to be met in a particular environment. The idea is that the concept of being outcome focused is that the outcome is that you have that proficiency and you can pick that up and take it to other places. So just because you achieved one of your proficiencies in one particular area, that doesn't mean that that you have to work there. If that makes sense. And that I think is really, really important, because I'm all about the myth busting. There is this myth that, oh, you can't go and work there, you weren't there as a student, you haven't got any experience of here. Well, actually, our proficiencies are designed to be applicable in all roles and settings. Here I am. I'm a trauma orthopaedic nurse by background. I'm now working in the NMC. There are proficiencies that work for me. Let me just grab one. So, for instance, 1.9, being an accountable professional, understand the need to base all decisions regarding care and interventions on people's needs and preferences, recognising and addressing any personal and external factors that may unduly influence their decisions. Everywhere you go, that's applicable. It's not something that is restricted to a particular area. And I think that's something that when you're looking for roles and recognising that your perfect job might not be the one with availability at that moment, just bear that in mind around those proficiencies should be applicable in all roles. And just a role, whilst I'm thinking about it, your first job may not be your forever job. It may not be the one that you want to do later in your career. Your perfect role might be one in a service that doesn't even exist yet. So just bear that in mind. So there you go. There's the standards. Think about those standards of proficiency. Think about how they're applicable in whatever role you're in. So we set those standards. We then approve and quality assure programs of nursing midwifery education. We don't write curriculum. Universities, AIs write curricula which are in accordance with our standards. So they bring those standards to life and think about how those standards are being met in their university, their education institution. And then we approve and monitor those programs to say, yeah, those meet their standards. But it always must be based on those outcome-focused standards. So we maintain with the register. Integrity of the register is our prime function, really, making sure the right people are eligible and fit to practice. And you can enter the register in a variety of ways. Completing a NMC approved programme, at the end of which your AEI, your university, will inform us that you're a right and proper person to enter the register, or people who can enter the register having trained overseas and meet various criteria to say that they meet the criteria that they can enter the register. And we also investigate concerns about professionals in our register. Here we go. No wrong answers. Just stick any answer you want in the chat. What percentage of people do you think come to the attention of fitness to practice to the NMC, of registrants? Just stick a number in. 5%? Higher or lower, ladies and gentlemen? Higher or lower? Is that 15%? Higher or lower? Anyone? Mary, I can tell you're thinking. And you're at 50%. So half all registrants come to the attention of fitness to practice at the NMC. And we're going higher. Any other thoughts? No. Shall I give you the answer? The answer is fewer than 1%. Fewer than 1% of nurses, midwives and nursing associates come to the attention of fitness to practice. And the reason it feels like more is because there are a lot of us. 1.2% of the UK population is a nurse, a midwife or a nursing associate. That fact blows my mind. If you're on a London bus, there'll be another nurse, midwife or nursing associate on the bus with you. I live in a really small village, not big enough for a pub or a shop. There are 8 nurses in that village. So yeah, there are a lot of us. So that's why it feels like more, but in fact, it's fewer than 1%. And many of those cases don't actually go further than screening. Our other function is theirs around revalidation, ensuring that we promote lifelong learning and people who are on the register can demonstrate that their skills, knowledge and experience are up to date and they've met those revalidation requirements. So I'm actually going to switch to another thing here because this is what you want to know. And I'll ask for this to be sent out as well. This is what happens when you've completed your programme. So at the beginning, the student's information is uploaded to us via a particular portal which is by your university. Your personal information and details about your training, and the university will make sure that that's completely up to date, and because that can take just a couple of hours before you as a student receives information. But we receive that information and a file is automatically created and an automated email comes to you inviting them to register that qualification and prompting the creation of an NMC Online account. It's called something slightly different now. It's not called NMC Online, but it's that account. And then if you apply for that registration within 6 months, you don't need to do anything else. If it's more than 6 months, you're also required to enter the detail of another registrant who can confirm that good health and character. That's usually done immediately by the university. Once that's all happened and we've received that online form and we've got you've paid your money, we've received the form, confirmation from the educational institution, we assess that application and there you are on the register. This used to take months, then it took weeks. It's happening in days now because it's a largely automated process. If you don't get that email, the best thing to do is check your junk email. And also just ahead of that, just make sure that you've not set up your email to think that things from the NMC are junk. There is a way of doing that. You don't need to wait for the email and you will have that PIN. Most applications are automated and processed within 24 hours now. Sometimes things take a bit longer. That's usually not because of anything you've done wrong. Okay. Checking where I am for time. Please make sure that you sign up to our newsletters for nurses and nursing associates, midwives, students, educators, and there are also ones available for employers and the public. Do make sure that you do that. That's a really good way of making sure that you're up to date with what's happening with the NMC. We are your regulator. We want all the same things. We want safe, kind and effective care, just the same as you do. We are having a code and revalidation review at the moment. So do make sure that you're involved with that. But I think probably it's now a good time to pause for reflection and questions. And I'll make sure that that information around the code and revalidation reviews does come to you. I say no question too big, too small, too daft.
Thank you, Wendy. Does anyone have any questions for Wendy?
And we're so not scary. Just to bust that myth.
Well, I've got one, Wendy.
Yeah.
What about if I get my qualification, I graduate, but I don't manage to get a role straight away?
Okay.
Would I need to register anyway, or can I wait for a while? Or
entirely up to you. Say if you do choose to do that after 6 months, you will need that additional good health and character notification from another registrant. But I think this is probably nurse me rather than NMC me. I think if I was recruiting and someone said, yes, I've registered, I'm good to go, I haven't been able to secure a role for it, but I've used the time wisely to do some reading, to do some real reflection on my education, because you can actually start, if you're on the register, you can use that time to accrue CPD, ready for your revalidation. Which will happen in 3 years, or I just warn you now, approximately 10 minutes. It goes go by so quickly. But what you can't do is accrue practice hours until you're actually working a registered role. So people frequently ask me, can I get a job as a care assistant in the interim? Yeah, here as your regulator, we cannot tell you what jobs you can and cannot take. You can get a job in a bar if you want, but what we can do is tell you what can and cannot be eligible for practice hours for your revalidation. So that needs to be in a role where you're a registrant and you rely on the skills, knowledge and experience as a registered nurse. So it can't be in a support worker role. It doesn't actually have to be in a role where you have to be a registrant. What it does have to be is one that you rely on the skills, knowledge and experience of a registered nurse. So you can, because it's practice hours, not clinical hours. I don't wipe. My full-time job is here at the NMC. You couldn't unnurse me if you tried. I absolutely rely on my skills, knowledge, and experience of being a registered nurse. I think I couldn't do this without that authenticity. And I work under the code every day. I've just popped the revalidation requirements on screen there as they are. Next time, actually, when many of you revalidate, this may be under the new rules. New revalidation requirements. But one thing that probably won't change is the 450 practice hours over the 3 years, which is around, I think it's 3 months full time. And the reason it has to be like that, we need to accommodate things like back-to-back maternity leaves. It does happen. So 450 hours. And when it says 900 for dual registration, we need to be clear on what dual registration is. Dual registration is when you're a nurse and a midwife, or a nurse and a nursing associate. What it doesn't mean is if you hold more than one field. because you've still got one registration, which is nurse. So, for instance, if you're learning disabilities and adult learning disabilities and child, although you do have to pay initially to have that extra field recognised on your registration, when it comes to revalidation, you only pay to revalidate once, and you only pay one as flat rate single fee, and your practice hours and your CPD feedback, reflective accounts and so on needs to reflect both fields. And of course it will, you know, if you're, for instance, adult and learning disabilities, people don't stop having a learning disability because they've broken their leg or or whatever, you know, people's adult conditions can also coexist with their learning disability, and of course that is why our proficiencies are also outcome focused. So it's looking through that lens of learning disabilities nursing or adult nursing. Adult nursing is also not physical nursing; it's adult. Because, you know, we need to make sure that we're looking at holistic person-centered care, whatever field we're working in. I did write myself a few notes just to say what would I do, and this is me, and I know I've got 3 minutes looking for that job. I've already talked about your forever job. It, you know, may not be your first job, and that's okay. This is my best job. I couldn't have done it as a newly registered nurse, and neither should I have done. You know, I've accrued 40 years of experience, so, and one job has led to another. As I say, it may be in a service that doesn't exist yet. Look for where you're supported, where you feel that you're going to grow, where you feel you can consolidate the last 3 years. Don't let anyone tell you that community social care is not a suitable first role. Simply not true. And think about your transferable skills. Think about those. I keep banging on about outcome focused proficiencies. Yes, you're a registered nurse is the answer. Why would you want to? I feel it's got perhaps nurse me saying rather than NMC me, but perhaps, you know, with those transferable skills. But also think about where there is crossover, where there is going to be a need for someone with learning disability nursing skills that may not be obvious, if you like. Think about social care, think about care homes, think about older people care homes, not necessarily learning disability specific care homes, but they may have people, a need for your skills. I hope that helps, and that's very much nurse me rather than NMC me. But we kind of coexist in the same body. And so 1539, I'd say wow. No question too random. Thank you.
Thank you, Wendy. Are there any further questions for Wendy? A very interesting talk. Thank you. Really helpful to know what we have to do, and also about revalidation. And absolutely, I do agree with you. Your first role may not be the last role that you work in.
Shouldn't be.
Most of us, I think, on this call have had what we call squiggly careers, where we've gone across and done different things, and you know, so it is about finding a starting point and seeing where you want to go. I think from there you may be surprised at where your journey takes you.
Yeah, and who knows what's around the corner in terms of healthcare, and say a service maybe just being created in a meeting room right now, which may be your perfect job in 5 to 10 years' time, and it may take that length of time before that service is actually launched.
Absolutely. Thank you. Very valid point. Thank you. So we're sticking very well to time. I'm quite impressed. I'm not usually this good at keeping to time, so I appreciate everyone for helping me out here. So Kate, would you come in next and talk about interview preparation?
Thank you very much for having me. Yes, absolutely. And I think, you know, when we're talking about interview preparation, and it's lovely to follow on from Wendy, it is about thinking about that squiggly career, but also thinking about all the amazing things that you've done during your training. You've already had a squiggly training, having worked in lots of different areas on placement. So, you know, starting with a notebook and having a real good think about all the different experiences you've had will really help you with that interview preparation. Can I check that my screen's sharing, please?
Yes, it is. Yes,
okay,
thank you.
That's great, thank you. So an introduction to the Student Hub, first of all, for those of you that have downloaded the Multi-Professional Learner Toolkit app, and Davinia's put the link in the chat already. I'm headlining it, and then Davinia's going to come in and tell you what else is already there. One of the first things that there is a great career preparation tile on the app. And if you are downloading it now, that's great. But under there is the Student Hub web pages. Now, the Student Hub was generated last year for students by our national and regional student councils. And there's stuff on there that you really need. I've been privileged to work with our student council, but also with students in practice to help them secure roles. And as a regional team, that's what we're here to do over the course of the next few months. And the Student Hub pages, I've got really good advice, good questions, good preparation. So please do go and look at that. So on the Student Hub, there's how to apply, and it's advice on what to do before your nursing interview. So, you know, if it's an in-person interview, visit the location beforehand, know where you're going. Don't arrive fluffed and worried and ruffled. You know, make sure you know where you're going, and plan for those delays as well. You know, make sure that you're planning to get there early. You've got time to settle yourself and make sure that you're ready for that interview. Check parking and transport, understand the role of the organisation. So if you're going to a new organisation, somewhere you've not worked before, make sure that you are very clear, do that research on the on their website, and talk to colleagues and staff at the organisation if you can. Research the service. Again, if you've been on placement there, that's great. We know from our Student First Destination survey, which is starting next week, we're launching it next week for over the summer to find out where our students go, that usually people have had a placement there or know somebody that works there. And it's that family connection, that friend connection, or that professional experience that will help. Know their values. Every organisation will have a set of values, and you need to make sure that you've really rehearsed those off by heart. You know, tell them yourself when you're driving or cycling or walking to work in the morning. Make sure that you've got those very clear in your mind. And contact the employer in advance if you require any reasonable adjustments. It's really important that you shine on that day. So set yourself up to succeed. Also on the hub is advice about taking a copy of CV with you if you think you might need it, or some certificates, and any pre-employment ID checks if it's in person. But there's also a great advice on there about the designated pages and links if you want to go and have a look. And there's also some links to the YouTube videos if you're somebody that likes to see things in practice and have a go at it. There's some really good links there on YouTube too. When it comes to interviews, and first impressions do count, whether it's on screen or in person. So always look smart and professional if you're in person. Clean shoes, hair, nails, teeth. You know, just really think about that first impression. If you can demonstrate that you can look after yourself, then that gives the clear impression that you can care for other people. So, you know, it is about making sure that you're demonstrating that you're looking after, you know, how you're presenting yourself. And we do recommend not going in with too much stuff. If you've travelled quite a long way, I know that's quite tricky, but just ask if there's somewhere you can leave the things that aren't valuable and just take those small valuable objects in if you're going in person. But actually, it's the same on screen. Always looking smart and professional. Again, it's still clean hair, nails, teeth still apply. And please remember, you might be on a really big screen in a room with people. So you might be super magnified when you're beaming in. It might not just be on a small screen. So really think about that and making sure that you're presenting yourself well. And I think in both instances, having a glass or a bottle of water at your side is really important. I've got mine today, and we'll talk about why that is important to keep you hydrated, because that is key, but also how it can be used to just buy you some time. So start by taking a breath. And I would suggest you do that when you start any interview, because you have everything you need. You've done 3 years of training and you are already set up to succeed. So it is really just about making sure you're rehearsed and tapped into that. So in person, we do recommend good eye contact because that demonstrates your communication skills. And it's always good to say, it's nice to meet you, or thank you for having me, or I'm so glad to be here at this interview. Just breaking that ice, just as you would with your patients. Do not overuse people's names. When you're nervous, and I can see everybody's name on the screen, you can start just saying people's names repeatedly. But just remember, even in person, not to keep overusing somebody's name. Listen to instructions really carefully, and if you're not sure, ask people to repeat them. Do scan the panel. Don't just focus on one person. I know it, the friendly face or the person smiling at you can seem the person to look at, but just make sure that you're looking at everybody carefully and calmly during the interview. Try to say positive things. I think it's important to be reflective, but it is a positive interview with an opportunity for you to shine. And smile and be polite to everyone you meet on the way in and the way out, because you don't know who you're meeting on the way in and the way out, particularly if you're going to a new organisation. On screen, engage and look at the screen. Nice to meet you again. Do not overuse people's names, as we've said. Listen to instructions carefully. Try to say positive things and smile and be polite. And it goes such a long way in terms of helping and settling everybody down. How to manage those nerves? Well, the first thing is ask for some support early. Get to know what adrenaline does to you and your coping mechanisms. And I've coached so many people through interviews, and there is a way within you to help you be calm in that situation. So it's ask for help early if you might be nervous. Deep breathing, sort of breathing in for 7 and out for 11. Box breathing slows down, or even in for 4 and out for 4, which you can do really discreetly. Just focusing on it, just taking a pause for a minute while people are talking. Sitting up straight also makes that difference, because then you can do that nice breathing and people perhaps don't notice so much, but it just does steady you. And being well hydrated for the 24 hours before, if you can do that, that will make such a difference to your alertness. And you know that being hydrated is really important for your well-being. There's 5 ways to give yourself time to think with interview questions. So these are what I call my get out of jail free cards, like in Monopoly. Take a drink of water. It buys you at least 5-10 seconds. You just say, I'm just going to have a drink of water, or you can just take your water. You can also ask them, the panel, please can you repeat the question? I'm a little nervous, please can you repeat the question? Just buys you that little bit more time. I think you're asking, and then maybe paraphrase the question back, and that's good, or a thought-provoking or an interesting question, and that just gives you that little bit of time while you take some moments to think it through. If you're going to do anything in terms of preparation, you need to get this question right. I've regularly suggested that people take themselves out for a walk and say, right, why do I want this job? And really get that one well rehearsed, because in some way or other, they're going to ask you why you want the job and why you want to work there. Even if they just say, tell me something about yourself, which I know colleagues, I know students who've been interviewed recently have had that kind of a question. So just think about why you really want the job, write it down, memorize it. Don't take it to the interview, but think of 3 or 4, 5 really good reasons why you want the job, and try and finish with a punchline, a really good reason, and read it every day before you go into the interview. And then for other scenarios that you've been in, you're almost certainly going to be asked, and on the hub there's loads of ideas about the things you might be asked, but if you can rehearse maybe 5 or 6 answers of where you've really shone, where you've really been a star, and use the star model of the situation, the task, the action, and then what happened, get those written down and rehearsed. And I often recommend just recording them on your phone so you can hear yourself, and you can also do that so it's actually written out for you so it sounds like you. But get those rehearsed. If you think most interviews are going to have maybe 10 questions, maybe 12 maximum, but definitely no more than 10, you could have 5 or 6 of those questions really well rehearsed before you go in. And examples from your experience so that you do shine could be around leadership, patient safety incident, escalating a concern, managing a deteriorating patient, when something went wrong and how you managed that risk really well. Clinical experience you're really proud of. Conflict management, maybe somebody made a complaint or was really worried or concerned or angry, and how you manage that situation. And those questions around equity, diversity and inclusion. And have examples of when you've demonstrated those organizational values as well. And what you'll probably find is if you rehearse those, the why do I want the job, and maybe 4 or 5 other examples, you'll literally be able to pull those off the shelf in your mind and be ready to answer at least half of those interview questions. And then ending an interview, have some questions for the panel. And there's some great questions for the panel on the Student Hub. You know, what does the preceptorship programme involve? How does the team support continued professional development? And if the panel do not tell you, always ask when they will be contacting you, so you're not worrying at home whether you've been successful or not. And find a phrase that feels right for you. I would like to thank you for this opportunity. I very much enjoyed this interview. I'm very interested in being appointed to this role, whatever feels comfortable to you, but any of those phrases, and there's more on the hub. So thank you very much. I think I was a minute over, Mandy, please forgive me, but I really hope that's really helpful. But go to the hub, there is so much on there, and these recordings will also be there too. And can I just give a shout out for the Future Ready other webinars that are on where this will be gone into more detail. Thank you.
Thank you, Kate. And you're right, you're just a minute or so over. And I think I was very ambitious, thinking that both you and Davinia could talk about your respective subjects in 10 minutes. So Davinia has very kindly said that she will put all the information about the app into the chat so that it's available for everyone to look at, download, and have some information about. And so with that in mind, thank you, Davinia. If I can bring Jonathan in, please, just to talk about his career, that would be excellent. Thank you.
No problem. Yeah, thank you for inviting me along today. My Wi-Fi connection's a little bit flaky, so if I go all jittery, can someone raise their hand or something so I know, and I'll turn my camera off. But yeah, my journey into learning disability nursing is a story, I guess. So when I was 19, I was the victim of an attempted murder. I need extended drums when I say that. Ultimately, I was bashed on this side of my head, which caused my brain to bounce off this side of my head. I've got a scar here that's faded a lot now. Being bold means the sun gets to the scar and fades it away. Where I had a bit of my skull took out, they got to the subdural hematoma and put me back together again. At the time, the doctors thought I was going to die. Then they told my parents, oh no, he's not going to die. He'll be a cabbage all of his life, meaning that I would be in a wheelchair. I would be unable to talk, unable to change myself, unable to feed myself, totally reliant on others for my care. Fortunately, I recovered better than expected, but that got me thinking, well, what would my life have been like? And that's when I discovered learning disability nursing. And I think it's not uncommon for people to come into learning disability nursing because of some affiliation with the field in some way, shape or form. And I feel personally that every role I've had, I've looked at the support the person's been receiving and I've thought, well, that could be me receiving that support there, or it could be my mum, it could be my brother or sister. And learning disability nursing is very much a values-led profession, and I think approaching it with that sort of values and that integrity will get you very, very far. And if you can make those sort of values shine in your interview, that will go a long way too. I qualified in 2002. My career has been extremely varied, so I thought it would be useful to share the different roles I've had and show some of the doors that have been opened to me by the ticket I've had of having this registered nurse in learning disabilities qualification. Similar to Claire, I started off in a preceptorship role in a NHS trust. It was a split role. It was supposed to be 6 months in the community and then 6 months in inpatient services. I managed to make a good impression in the community team and a role appeared, and I was successful in getting that role. So I never got round to doing the rotational placements in inpatient services at that time. But yeah, I think being a male nurse, I had lots of work around sexuality come my way, lots of work around challenging behaviour, mental health. I loved working with people with profound and multiple learning disabilities. I was able to be part of a national research project on adapted sex offender treatment programmes for men with learning disabilities, which was an incredible experience. And by 2003, so my first year of being qualified, I wrote an article for learning disability practice. And that could be you. You could be writing articles and getting your name known and building your CV in your career. And I think something like that is always worth doing. I stayed in the community team for 5 years, worked my way up to being a senior community learning disability nurse. but thought, well, maybe it's time to try something different. And I got a job as a charge nurse in a secure forensic CAMS unit. There are only 5 secure forensic CAMS units across the whole of the UK, and this was a new one that was being built in Southampton. And while it was predominantly mental health nurses that were being appointed, they wanted a registered nurse in learning disabilities because they knew a large proportion of the people that they would be supporting would have learning disabilities. So that was a great experience to be there, to provide that expertise in what learning disability support was like, to visit lots of different services across the UK and learn from how they were doing things. But yeah, I didn't actually stay in that role for very long. I was offered a job as a clinical nurse specialist in Salisbury that was between their youth offending team and their CAMS team. So they weren't looking for a learning disability nurse, but I turned up for my interview and I said, as a learning disability nurse, I know all this stuff about child development. I know all this stuff about mental health and CBT practices. I know all this stuff about behavioural approaches. And I really sold what I brought to the role as a learning disability nurse, and they were impressed and took me on. It was quite a tricky role because I was not only the only learning disability nurse in the team, I was the only nurse in the team across 2 teams, and you need to learn a lot of skills then in self-governance and how you make sure that you're working to professional standards and look at how you can get accountability coming in. I was actually getting supervision from the director of nursing in the general hospital there because there wasn't that support available. But I think it's about looking at what can I bring to this role and then how can I get that security in place. From there, I managed to get a job with the Department of Health as it was then. It would have been NHS England, one of regional teams now, but it was the Department of Health, and it was for the South West, looking at the needs of offenders with learning disabilities. So I was going into all of the prisons in the South West and going, what do you know about people with learning disabilities? And oh, not a lot. And I was going to all of the learning disability services and saying, what do you know about prisons? And oh, not a lot. And it's then looking at ways of how to make the teams know more about each other and work better together. So that was a brilliant opportunity. Again, it didn't need me to be a registered nurse in learning disabilities for that role, but I went there selling what my experience, what my expertise was and what I could bring. From there, I went back to the trust where I started, and they were setting up intensive support teams for the first time, and I got a job as a team manager there. I was fortunate to be offered the pathway to do a master's in positive behaviour support during that time. And it was really creating what the service would look like, how we were going to be the barrier to people with learning disabilities in the community from being admitted to inpatient services and what we could do to prevent that from happening. It was a typically 9 to 5 Monday to Friday service, but it was looking at how can we work flexibly, so as if we need to work outside of those hours we can do. Looking at what multi-professional teams we need, what our model of operating was, how are we going to work with the community learning disability team, how are we going to work with the inpatient services to get people discharged. So that was another fantastic experience. From there, I went on to be Chief Operations Officer with a very small social care provider. Oh, sorry, I better hurry up. Called Waymarks, and we've already heard about working in social care being a great opportunity. Again, they weren't looking for a learning disability nurse, but that's what I did. I'll bring you up to today. So PBS4 is a company I've started myself from scratch. You want the opportunities. Sometimes you've got to create them. It started off with me with a little idea, and I thought I was going to do nurse consultancy with a bit of supported living in the background at first. Today we're supporting 120 people, employing 500 staff. I have a clinical team, and we put nurses through their learning disability nurse apprenticeships, and we've got 2 learning disability nurses that we employ in addition to myself. Working for the RCN is great because I am influencing what's going on nationally, and my work in PBS4 is bringing that real life stuff, a bit like Randy was saying, it brings that integrity to the national work, while I'm bringing the RCN's work to what I'm doing locally as well. So I think it's it's a really interesting time at the moment. We've seen lots of regional variations. There are challenges out there, but there are lots of needs, dynamic needs for registered nurses in learning disabilities. It's about thinking creatively about what you want to do going forward. I'll probably leave it there.
Thank you so much, Jonathan. And I'm really sorry to have to,
Sorry.
to give you the 1 minute warning, because it's very interesting and really highlights that career pathway and how one door leads to another and one role leads to another, and just being creative with how you're thinking. So absolutely fascinating to hear, and thank you very much. So I know we've gone over slightly already, but are there any questions for Jonathan that anybody would like to ask? I think Carrie's typing something in the chat, so we'll see what she has to say. Oh, did you have a question? Is it Carrie or Carrie? Sorry.
Hi, no, I was just going to say, sorry, I'll speak, it's quicker. I was just going to say thank you for sharing your story. It's really interesting to hear all the different roles and possibilities for a learning disability nursing, because you kind of, when you're doing your training, you kind of sort of see the things around you, but you don't necessarily look at all the different opportunities in different areas. So it's really good to hear that. Thank you.
What I would say is that things are shifting. We're seeing perceptions in learning disability shifting. You're seeing that with changes to the Mental Health Act. We've seen it with the closure of hospitals. And I really see us being steered more towards neurology now. So if you can't find the learning disability nursing job you want, maybe look at the neurology wards, look at the epilepsy services, look at stroke services, because there is a real need for our skills in those areas. And a learning disability ultimately is a neurological disability, and we've definitely got the skills to apply there. And as Wendy said, if anyone says you haven't got the skills to apply, you are a registered nurse first and foremost. We are trained to the same standards as any other nurse, and you've got every right to be there.
Thank you. Thanks a lot.
Thank you. I would absolutely agree with that. And I think, you're all standing at the threshold of wonderful things, and I wish you all the very best for your future careers, and that they're very long and happy ones, because I'm pretty sure they will be. So, and I just want to say, because we are running out of time, I just want to say a really big thank you to everybody who's taken time today to come and talk to us, and in Davinia's case, to put things in the chat for us so that we can have everything that we need to look at the app going forward. So thank you very much to everyone. I really appreciate your time. And if are there any other questions, just finally before we go? Okay, thank you. And thank you for your patience with my technical hitches at the beginning. And hopefully we'll see you all very soon. Take care now. Thank you. Bye-bye.
Thank you. Bye. Thanks very much. Bye.